So gross specimen number 1, leiomyoma. This is the specimen of uterus. You can see cervix below. And how do you describe the gross appearances? Always remember the code Supreme Court. You have to write about first is size of the lesion, shape of the lesion, C, color of the lesion, whether it is capsulated or not, and what is the cross section appearance like. Okay, and you have to write number. So let's start with it. So this is a specimen of uterus. So you can see cervix below. On cut section of the uterus, you can see multiple well circumscribed non-encapsulated lesions who are round to oval in shape, varies in size from 2 centimeters to 7 centimeters in size. Cut section is showing you whirling. Okay, so that is a word that you should remember. It's like whirls. Okay, so whirling. So the specimen is suggestive of leiomyoma. The gross questions that can be asked: is there any changes in this? So there is no degeneration, there is no necrosis, there is no calcification inside the leiomyoma. So therefore, the diagnosis is this is a smooth muscle tumor of the uterus, probably leiomyoma.